Hello and greetings. I'm Dr. Sunil Sazawal. I am the director and executive director at Center for Public Health Kinetics and professor at the center as well as at Subharti Medical College in India uh, and an associate at Johns Hopkins University in the United States. I also head as president the CPHK Global, which functions in multiple countries, more importantly in Africa, in Zanzibar. CPHK is a non-profit research organization created as a foundation to undertake research of public health importance, identifying interventions, and discovering modalities that can improve health of uh, lower middle income countries, especially India and Africa and South Asia, uh, which have similar health problems. We've been working for in this arena for last 3 decades. Our work in Zanzibar has spanned for nearly 21 years in close collaboration with Ministry of Health of Zanzibar, and have been involved with trying to undertake work that can ultimately be incorporated into policy and have reduction in mortality and morbidity in children and women, uh, primarily, although we also do work in other diseases and in adult conditions, but our primary work has been focusing around maternal and child health, right from one spectrum, which is program evaluation and programs, to clinical trials with new interventions, clinical trials with vaccines, and going on to the mechanistic studies where we're looking at discovery of biomolecules, discovery of predictors of morbidity in pregnancy and newborn children, with uh, omics developments that have taken place in genomics, proteomics, and metabolomics. There has been a huge amount of potential to discover what we had not been discovering so far, and what has added a lot of sort of excitement to this area is now development of an AI tools which now can be implemented across this spectrum of investigations that we have been developing in last decade or two, which has been producing large sets of data. And the primary problem of getting it into implementation and getting it into translation has been making sense of that data and making analysis of that data. And now with the AI tools, that has become more and more possible. And there is a huge bit of excitement as far as we are concerned, and I'm sure in a lot of other research groups, that using a combination of the traditional investigative tools that we have had with AI could deliver tools and interventions that might be of use in public health. Before I go to that, a bit about the organization. Organization is based in India as its headquarter, but it has a global presence. We are also registered as a non-profit organization in Zanzibar. Have been working there, as I said, for 20 years. In Zanzibar, we have an MOU with Ministry of Health. We also have a memorandum of understanding with the IIT Madras Zanzibar campus, and Zanzibar Health Research Institute, which is the prime body of the Ministry of Health for undertaking and governance of health research on the island. In India, we work with Indian Council of Medical Research and other organizations. CPHK over the years has been funded from Gates Foundation, from WHO, from NIH, from Thrasher Foundation, and many other organizations of international repute from time to time. We have also been funded to national organizations with ICMR. Now we recently have been awarded the Advanced Center for Research from ICMR. We also have a Center of Excellence established in Subharti Medical College, as well as a clinical research center established in LL Medical College in Uttar Pradesh. So we do have a broad footprint at the community level, at the grassroots level, at the laboratory level, and at the policy level, so to say. We have been fairly productive in terms of the publications, have even in last 3 or 4 years had at least 30 publications in very high-end journals with very high impact. We have published in Lancet, New England Journal, multiple papers, so to say. So with all of that, Center for Public Health Kinetics can boast of being one of the top, one among the top primarily research organizations, non-profit research organizations working in India and Africa, especially Tanzania, East Africa. Having said that, we are poised. We also are we're looking forward with the availability of AI tools. We're looking forward to incorporate them into our research and our already existing data sets to help improve health. And that is what has been exciting about this new development that has taken place, which I'm talking about. Well, in terms of the background of this current application, the preterm birth is an important cause of morbidity and mortality in whole of global South, and more so in South Asia and Africa. It not only causes high mortality, but also causes impairments that have long-term consequences in terms of child development, child growth, and therefore is a priority for public health in all of these countries. The problem has been that we do not have biomarkers for early prediction of preterm birth, because one of the things, there are only two modalities that exist for doing anything about preterm birth. Is either we should be able to predict it early on so that we can triage those pregnancies that have high probability of delivering preterm to be attended by centers that have adequate facilities of conducting those deliveries and reducing the adverse outcomes of those deliveries. Or the other option is to find the mechanistic causes that is causing preterm births, and therefore develop interventions where we may be able to prevent preterm births. And both of these need very deep dive into the omics and the biological mechanism behind. And because of the difficulty of that area, it has eluded science any solutions, not only in the developing countries but in the Western world, where again it is a major problem. It may be associated with a slightly lower morbidity there, but it is definitely associated with very high expense in terms of the healthcare costs. It also is associated with the implications in terms of hospitalizations and all other things associated with those hospitalizations. So there is a concerted effort into trying to do discovery around occurrence of preterm birth. Now, this discovery can be in terms of molecules that we can identify or systems that we can identify for an early identification of high probability or categorizing probability of pregnancies that might lead into preterm birth, or and also understand the mechanisms that are leading to early delivery, which means that why does a woman throw this baby out before it really is ready to face the world. And this is not an easy area of investigation, and therefore it is very expensive to investigate. It is, and that is why it has eluded. In this connection, we have been the Ministry of Health in Zanzibar and Center for Public Health Kinetics, uh, along with a couple of other places, countries, groups in Bangladesh and uh, Zambia, have been with the funding from Gates Foundation, undertaking a large cohort of pregnancies. We have about 5,000 pregnancies in the cohort in Pemba in Zanzibar, uh, which is where the pregnancy was followed right from conception on to the delivery, and then the baby was followed up to 3 years of life. So we have, and this was accompanied not only by metadata collection, clinical data collection, but also biospecimens along the way, including blood, placental tissue, cord blood, and categorizing the baby in terms of gestational age with an ultrasonography at the end. So it was a very well sort of using international standards to categorize a pregnancy cohort with biobanked samples. And these biobanks, and again, this was primarily to do discovery research in the maternal complications, which included preterm birth as one of the most important outcome, adverse outcomes of pregnancy. This investment is a large investment. It took 7 years of work. We established a biobank. We collected the samples and with international quality, and luckily were funded with Gates Foundation as second part in the MOMI, where all of these samples were characterized for proteomics, for metabolomics, for genomics. So we have a cohort of pregnant women characterized for whole gamut of things from metabolome, proteome, genome, biochemistry, and then clinical stuff with the outcome data, both for preterm and non-preterm deliveries. And that provides a very important resource where the discovery research can take place, identifying both the predictors, building models for prediction, as well as finding mechanistic ways how preterm birth is happening. I am very happy that with the current Google call for AI, CPHK has built a consortium along with IIT Madras and IIT Madras Zanzibar campus. CPHK already has a collaboration with Ministry of Health and Zanzibar Health Research Institute. So we got ownership of the country, we got the ownership of the local system and the government to translate those findings. We also have IIT Madras as a leading data sciences group and AI group in India and in Zanzibar, and now we try to partner also with Wadhwani Global, who have footprints in multiple East African countries and access to the governments, and if we need validation studies and if we need scale-ups, also they also have a large footprint and presence in AI developmental arena. So we have been able to sort of marry two important components in this project. One is the availability of these cohorts from Zanzibar, and then we have also the cohort from Bangladesh and Zambia for validation purposes, uh, which has taken, at least $40 million to get done uh, over 10 years of time with large research teams, and is actually a resource that is a gold mine pending to be discovered, pending to contribute to the humanity. And on the other hand, we have the the team that's come together uh, as a consortium, uh, plunging into this area to find and apply AI tools and AI development to develop, use the metabolomics and multiomics data that we have and the outcome data we have to build uh, AI based modeling, where we should be able to build not only the prediction modeling but also to build tools which could then be implemented into the real life scenario within the health ministry. And if successful, if this successful, it would really change the scenario without having to wait for 70 years for the health systems in these countries to develop and get to the Western world to reduce mortality. We could, with the identification in the peripheral and primary health care, be able to predict high pregnancies, high probability of preterm births, and actually triage them to the facilities where the care is possible. That would immediately reduce the mortality. And also, the mechanisms that are developed could lead to drug development or intervention development for future in terms of the preterm delivery. Having this AI work for synthesizing this complex arena would be a huge leap forward in improving the health of these populations and meeting SDG goals 2030. And therefore, I have great pleasure in trying to strongly recommend this project for funding for the through the call, Google call for AI, uh, as one of the calls that has a lot of scientific background, B, has already a lot of investment gone into getting to a point where it can be used, the models can be built, and C, having a world-class, top-notch consortium together working, which is spanning from healthcare professionals to data science people to omics people together. And it's a very unique sort of an opportunity and a unique sort of consortium that has potential to find some answers. Thank you.